All right, guys, welcome to the final chapter of this module. This is on blood vessels, and I'm going to tell you right up front that I do not ask you guys many questions on this chapter in your lecture exam, but I'm still going to include it because it will help you studying some of the blood vessels that come off of the heart in for lab, as well as studying some of the arteries and veins in the body. So I'm going to go through it rather quickly. I don't ask you guys many lecture questions on it, but it will be helpful, especially studying the blood vessels that come off of the heart. So we have three types of blood vessels that I've been talking about: arteries, capillaries, and veins. Arteries carry blood away from the heart. Arterioles are the smallest arteries. Capillaries are the smallest blood vessels in general. Venules receive blood from the capillaries, and then veins receive blood from the venules. The structure of blood vessels walls, they're all composed of three layers, and the layers will differ in thickness between arteries and veins. And this takes you through the three different layers: the intima, the media, and the externa. And the word lumen is the word to describe the central blood-filled space. And this is underneath the microscope. You can see differences between arteries and veins. So arteries have a much thicker tunica media, that's the muscular portion, and veins are much thinner. So the veins often collapse on themselves, whereas arteries have a lot more elastic tissue, which keeps them open. So here's some differences: the generalized structure of arteries, veins, and capillaries. And you can see here how the different layers of tunics differ just slightly between arteries and veins. And then capillaries are the thinnest. A lot of veins have valves in them, especially because of the veins that bring blood back to the heart to help overcome the force of gravity of the veins bringing blood back to the heart. The valves will close so that when blood reaches a certain level in the veins, the valves keep the blood at that level when they stay closed, just to help blood return back to the heart. Elastic arteries are the largest of the arteries. These are the aorta and its major branches. And you can see here just a lot of elastic tissue in the walls. This elastin in the tunica media allows the aorta to stretch because of the great amount of blood that's being forced through it during ventricular contraction. Then we have muscular distributing arteries. These are the names of the arteries that we often give names to throughout the rest of the body. And then arterioles are the smallest arteries that you can see here. Capillaries are the smallest blood vessels. There's site-specific functions of capillaries. In the lungs, oxygen will enter blood, carbon dioxide leaves. And then the small intestines and the endocrines and the kidneys all have kind of different functions of the capillaries depending on where they are. Diameter is so small that red blood cells will pass through in a single file line. And you can see a capillary here with red blood cells passing through. Then we have different types of capillaries: continuous capillaries, fenestrated capillaries, and sinusoid capillaries. And again, I ask you guys too many questions about this into and out of the capillaries. In the blood-brain barrier, these are capillaries that have complete tight junctions, and they allow vital molecules to pass through, but not anything harmful. Some things can still get through though, like oxygen, carbon dioxide, and some drugs. Capillary beds are the network of capillaries running through tissues. Tendons and ligaments are poorly vascularized. Epithelial and cartilage have no capillaries. And we have sphincters, which will regulate the flow of blood to the tissues through these capillaries. So you can see these sphincters will contract to kind of disallow blood from flowing through, and then they'll contract to allow blood to travel through. And then the venous vessels, I will let you read through the venules, which are the small veins. They'll eventually form into veins, which are much larger. The walls of veins are much thinner. The lumens are larger, and about 65% of your body's blood is held in the veins at all times. So we often call your veins or the body's reservoir system for all the blood. So here's the summary of blood vessel anatomy. You can see them here, the average thickness of their walls. And again, I do not ask you, I think, any questions about this, but I'm going to talk a little bit about the heart when we get there some more. The valves in some veins just prevent backflow to return blood to the heart. And the skeletal muscle pump is when your muscles press against your thin-walled vein to kind of squeeze the blood up to the heart too. So here's your skeletal muscle pump helping get blood back to the heart. Vascular anastomosis is when the vessels interconnect. So I'm going to kind of Okay, here we go. So pulmonary trunk. So this kind of takes us through some of the major blood vessels leaving and entering the heart. The pulmonary trunk leaves the right ventricle and divides into right and left pulmonary arteries to bring deoxygenated blood to the lungs. So you can see here the pulmonary trunk divides into right and left pulmonary arteries. You can see these arteries are blue because they're deoxygenated blood, but they're carrying blood away from the heart to the lungs where they pick up oxygen and then bring oxygenated blood back to the heart via the left atrium. Systemic arteries, the aorta is the largest artery, and then these are the major arteries of systemic circulation. You will be studying some of these in your labs, especially some in the arm and the legs and how that branches. Here are major arteries of the systemic circulation and where you can feel the pulse throughout the body, so the heartbeat. The ascending aorta arises from the left ventricle, and then it branches into right and left coronary arteries. The aortic branch lies posterior to the manubrium, and these are the three main branches of the aortic arch, which I do want you to know for lab and lecture, and I'll show you a picture of this. So as the aortic arch comes around, these three branches come off of the aortic arch. The brachiocephalic trunk comes off on the right side, and that will branch into a right common carotid artery, which brings blood to the head and neck, and then the right subclavian artery, which brings blood to the right arm. The left common carotid artery brings blood up the left side of the neck to the head and neck, and then the left subclavian artery brings blood to the left arm. The descending aorta then continues through aortic arch. It eventually divides into right and left common iliac arteries, which will bring blood down the legs. And then we have pairs of arteries supplying the head and neck, common carotid, branches of the subclavian. So these are arteries of the head, neck, and brain. I'm going to kind of go over some of these because I don't ask you guys to know specifics in your lecture exam. In your lab exam, all that I'm asking you to do is to be able to identify the arteries that are found on the lab for practicum list. One thing in the lab exam that I do ask you, you can see here how this branches. You can see the subclavian artery is the name of the first branch, and then it just changes names when it gets here under the armpit to the axillary artery. And then it'll change name again in the upper arm to the brachial artery. And then it will split into a radial artery and an ulnar artery, depending on what side of the arm it's in. And I think those are common lab questions that I ask you. The subclavian artery goes to the shoulders. When it gets to the armpit, it changes names to the axillary artery. The axillary artery continues, but changes names to the brachial artery. And the brachial artery eventually splits into a radial and an ulnar artery. Here are arteries of the abdominal aorta. A big one in lab I ask you about is the celiac trunk. It's kind of the first branch that comes off of the abdominal aorta once it passes through the diaphragm. You have arteries going to the kidneys called renal arteries, gonadal arteries going to the testes or ovaries. And the common iliac arteries are eventually what your descending aorta will split into to bring blood to the legs. So you can see these arteries labeled here. And again, this is one I ask you in lab. So if you're listening to these lecture videos, you're getting a lot of help for your tests. So I hope it's helpful. Here's branches of the abdominal aorta that supply the organs of the digestive tract, and more branches that supply the organs of your digestive tract, the large colon, arteries of the pelvis and lower limb. This is important to know because this is a lab question as well. So we have the descending aorta bringing blood down, and it will split into common iliac arteries down the legs. And then the common iliac arteries split into an internal branch, internal iliac, and then an external iliac artery. The internal iliac artery supplies blood to the reproductive organs, and the external iliac continues down the leg, and it will eventually change names right here into the femoral artery, which will supply the muscles of the quadriceps. All right, and then here are the arteries of the right pelvis and the lower limb, and of the lower limb in the back as well. Systemic veins, again, not many questions on this at all. Superior and inferior vena cava will return blood back to the right atrium. Superior vena cava returns blood from the body regions superior to the diaphragm, and the inferior vena cava returns blood from the body regions inferior to the diaphragm. They join at the right atrium. The nice thing about your veins is a lot of them follow a similar nomenclature and branching pattern as your arteries. All right. It's a little different around the arteries that come off of the heart. The brachiocephalic veins will branch off the superior vena cava to supply blood to the upper limb and the head. Here are some of those branches, the brachiocephalic veins coming off of the superior vena cava. Then they will branch in the same way into a right subclavian, eventually into a brachial vein, and then eventually into a radial and ulnar vein as well. So again, I'm going to pass through some of these. The rest of this, I don't ask you guys too many questions. You might need to study and review some of these veins that are on the Lab Practica master list. The hepatic portal system, you'll get this in physiology. This is a specialized part of the vascular system. It picks up digestive nutrients and takes them to the liver for processing. So it takes the digestive nutrients around the digestive organs and takes them for the liver. And we call this whole system the hepatic portal system. All right, and with that, I think I don't ask you guys too many more questions. I might end here with the disorders, though, of the blood vessels. We can get an aneurysm, which is kind of a ballooning, or kind of when a blood vessel increases in size, like it looks like a balloon around it. A deep vein thrombosis is a clot of the lower limb. Venous disease, microangiopathy of diabetes, or atriovenous malformation. Here's an aortic aneurysm. So here are your kidneys. So this is showing kind of an atherosclerotic plaque, which is leading to kind of a blockage. So behind the blockage, we get a ballooning, an aneurysm. These aneurysms are scary because they could eventually burst, which could be bad, causing internal bleeding. Fetal circulation, I don't ask you guys questions about fetal circulation, but this is, again, kind of interesting to see how fetal circulation develops in the womb. Blood will bypass the lungs because the lungs aren't fully developed in a fetus. So you have different changes in the heart, which I talked a little bit about in the last chapter. And you can see how the placenta will oxygenate fetal blood, and that oxygenated blood will travel to the heart for then distribution. Vessels to and from the placenta, shunts away from the pulmonary circuit, again, because the lungs aren't fully developed yet. Blood vessels in adulthood, atherosclerosis will begin in youth. And this is when the plaques will the arterioles will build up with plaque. You could experience heart disease and atherosclerosis later in life, but they can develop in youth. So what you eat and how you exercise as a youth will directly affect your arteries and your heart function later in life. So thanks for listening, guys. This is the end of this module. I tried to give you as much help as I could. Keep up the great work. Good luck on your tests, and we'll see you for the final module next week.